How do you diagnose it? In large dysfunctional ovaries. We can see those oftentimes by ultrasound. There will be a string of cysts that will line the inner capsule of the ovary that look like a string of pearls. The LH and FSH ratio is probably the most commonly used lab study. LH is typically about 2 to 3 times higher than FSH, indicative of this being something along the lines of polycystic ovaries. DHEAS, a free testosterone level, and a hormone called androstenedione. All three of those are male-type hormones, and again, oftentimes are elevated. These are the things that are associated with the hirsutism that we talked about, the hair growth, the acne, the male pattern baldness. Hemoglobin A1C is very important because, again, that's helping us to look at, is this a prediabetes developing syndrome, or is this going to potentially lead to that particular problem? We also want to know what the fasting insulin and fasting glucose are. The next step would be to check a lipid panel. We're talking about cholesterol, we're talking about triglycerides. I like to draw 2 other labs, and apolipoprotein B, a marker on a specific particle that carries cholesterol, specifically for particles that are much more atherogenic or much more likely to cause cardiovascular disease. And also SD-LDLC stands for small dense LDLC. They're very indicative of high sugar intake. If patients are having really heavy flow, then check in a CBC, which is a complete blood count, to look for a hemoglobin, hematocrit. You may even draw a ferritin level to see if their iron is low